Thank you for checking out another video from the upper hand in our KT taping series. Today I'm going to show you a super easy but extremely effective method to help with carpal tunnel syndrome. Okay, so there are several different types of tape out there and different brands that you can use. Basically, I just went ahead and took this and I cut. This is about 13 inches. It's going to vary patient to patient just depending on their hand size, but this is usually a good amount here, or a good length here. I've already rounded my edges on one side, and on the other side I'm going to basically cut a line right down the middle, and I'm going to go almost, not all the way to the other side, but most of the way, and it's going to leave about maybe 3.5 to 4 inches from the end of the slit. And we'll show you a close-up of that in just a second so you can appreciate that a little bit better. And I'll go ahead and round the corner of this one as well. So this is what you'll end up with. Okay, just like with any type of KT taping or any sort of taping at all, you're going to take an alcohol prep pad and really prep that skin and get all of the oil or any type of lotion that they may have on their hand so that it sticks a lot better. I'm going to let that dry just a little bit. Okay, so what we're going to do first is the end that is not cut, we're going to tear an inch or so of paper off of that. Then we're going to go down here to the slits and do the same thing. We're going to tear through that back paper. So it'll look something like this. The first thing we're going to tear off is this little end section. We're going to have the patient go palm up. And the first piece of tape is going to start on the ulnar half of their hand, right along the border of the carpal tunnel. So if you can just imagine that carpal tunnel, that median nerve being right in this area here, we're going to take this piece of tape and start it right at the ulnar border of that carpal tunnel area. This section does not have any stretch because you want it to stick and hold well in that area. Okay, after you rub the tape to activate the adhesive, we're going to tear off this first back section. And then we're going to have the patient pronate or turn their palm towards the ground. And then you can't really see their skin from that angle, but I am pulling this tape and putting about a 50% stretch on that. And then I'm going to lay that on the back of the hand. Okay, again, rub that in really good. Okay, so now we've got two little sections left that we're going to use. If you notice here that you've cut these way too long, you can always go ahead and cut a little bit off at this point. This looks like it's going to be pretty good for Dylan. So we can go ahead and tear the back of this tape, again, about an inch or so. It just gives you a little bit of a tab to hold on to so that your fingers are not touching the tape, because that will certainly make a difference in the amount it sticks to Dylan. So I went ahead and did both of those tears, and we can do one at a time. It doesn't really matter which one you do first, but you're going to tear that tape off, hold your tab here. I'm going to kind of supinate his hand some, and basically what we're doing is coming around the base of the thumb, and I'm going to go all the way up into that opposite border of the carpal tunnel. And usually I leave just the tiniest little gap right there. And then we're going to circle that all the way back around through the web space. Just doing a small stretch there, nothing too aggressive. And then, of course, your little tab does not need to have any stretch on it at all. Again, rub that tape to activate that adhesive. So you can already see before we even do this other tape that what we're doing is trying to kind of splay that area open a little bit, and it just gives the carpal tunnel a little bit more room to breathe in there. You know, what we're dealing with is a compression of the median nerve, so there's not enough room for the nerve to breathe in there. So we're basically just kind of opening that area, giving it a little bit more room to breathe, and hopefully help with some of their symptoms that they're having. Okay, so now we're going on to our second piece, or second strip. And tear that off. And now basically we're doing the opposite of what we just did. We're starting to come through this thumb web space here, and we're just going to lay this on top and then back around to the back of the hand. Rub it to activate it. There you go. So this tape can last anywhere from 24 up to, really a few days. Sometimes on the hands, it comes off a little quicker because you're using your hands a lot more and they're touching things. But I've had patients that have worn this for, 2 or 3 days without any issues. All right, guys, so that's a super easy way to tape for carpal tunnel syndrome. It is by far the best way that I've found with my patients to alleviate some of those symptoms of carpal tunnel, like numbness and tingling. If you guys give this a try and you have some success with it, please drop a comment below and let us know. We would love to hear.
So, I mean, my hand is not numb and it's not tingling at all.
Oh, nice.
Yeah. It wasn't before, but it's definitely not now. So, it's probably doing something.